Welcome to the Golden Jubilee Foundation, a national health board serving all of Scotland. You know, we're in a very privileged and unique position that not only do we have our own hotel here, we have our own research and skills unit and an innovation centre, but we are very unique in having one of the most highly acute and complex hospitals in the country. Our board's vision reads quite simply that we will lead on quality, research and innovation, and do that on behalf of Scotland and share that around Scotland and indeed on an international basis. We will provide that quality in every aspect of care, never ever compromising patient safety. And we've done that through developing a very unique and innovative quality framework and digital dashboard, so that whether you're a nurse in the ward, a doctor in the theatres or a manager in a department, you'll be able to get that assurance that patients are safe, that care is effective and that everything is person-centred. But of course our most important resource is our staff, and hence we have recently developed our leadership framework where we provide personal development for every member of staff to be able to do their job to the best of their ability.
This year we focused on delivering our commitments set out in our Staff Governance Action Plan and have made excellent progress. We've continued to embed our values with a focus on team effectiveness. We've reviewed and updated our Staff Governance Action Plan to include Everyone Matters, and also our feedback from the National Staff Survey. We've also implemented every NHS Scotland PIN policy. We are the first board to complete the full rollout of iMatter within a year. Our board employee engagement score was 77%. We've improved our performance against the Knowledge and Skills Personal Development Review target, with 80% of reviews completed by the 31st of March 2015.
We were also absolutely delighted to finish in the top 100 for the Stonewall Workplace Equality Index. We're the top performing NHS Scotland board for the 5th consecutive year, and it's been a real delight to finish in the top 100 list for the first time.
Well, we actually started 2014-15 with a plan to deliver 27,100 patients, and that would be inpatients, day cases and diagnostic imaging examinations. But in addition to that, we knew we would have to support the anticipated winter pressures. So in November 2014, we initiated an orthopaedic expansion plan, an ophthalmology expansion plan, and we increased our MRI capacity. By the end of that year, we surpassed our own expectations and we managed to treat approximately 5,000 patients more than we'd originally planned at the beginning of the year. Our planned activity target increased to 32,500 patients for 2015-16, which is an 18% increase. However, since then we initiated a further 2 orthopaedic expansions, which equates to 3 expansions in a 12-month period, a further ophthalmology expansion and a further increase to MRI capacity. Delivering these expansions is obviously extremely challenging. However, the staff throughout the hospital have risen to the challenge with their usual commitment and enthusiasm, and I have every confidence that we will deliver the additional activity for NHS Scotland. Throughout the past year, our orthopaedic surgeons have supported NHS Shetland, Highland and Orkney with outreach clinics. Follow-up for these patients has been carried out via video link to avoid unnecessary travel for patients. These clinics have been considered a big success for both the patients and the clinicians. In addition to the national waiting times work we carry out at the Golden Jubilee, despite the many challenges and increase in referrals, our Heart and Lung programme has managed to maintain delivery of the 12-week waiting time guarantee throughout the year. All cancer patients have been treated within 31 days of referral with an average wait of 12 days.
Finances remain tight. However, during last year we continued to achieve all of our financial targets. We achieved efficiency savings in excess of £3 million, which were 300,000 above our target. We did this through a continued focus on redesign and quality improvement schemes. We also invested £3.8 million in capital assets, including 2 large schemes. One in a boiler upgrade, which aims to deliver energy savings of up to 300,000 each year, and a scheme to upgrade our scope washers, which in turn created additional capacity.
There has been an increase of 40% in clinical research activity in the hospital. One of the key metrics is the time to approval by the Research and Development Department. And that time window is 30 days. So 100% of the clinical studies have been approved within 30 days, and 82% of the commercial sponsored studies have achieved that metric. So we are delighted by that success. The Golden Jubilee National Hospital continues to host a growing number of clinical research studies that are both academic, investigator initiated and commercial. We have exemplar clinical studies such as the Grey Zone FFR study, which is supported by the British Heart Foundation. This is a study which investigates an area of diagnostic uncertainty in the decision making for patients having a coronary angiogram procedure, where there's a diagnostic test called fractional flow reserve and there is a grey zone. So this study investigates that in more detail and will provide an answer in the coming 2 years.
This is a really exciting time for the Hotel and Conference Centre as we rebrand as the Golden Jubilee Conference Hotel. It's a key element of our vision to become an internationally renowned conference centre of excellence, particularly for the healthcare industry. So the move to the new brand is a really positive move, with the same people, same great service, same great quality of a venue, but we're just changing to represent our role as part of the Golden Jubilee Foundation.
Okay, so the management of risk is absolutely central to the delivery of our corporate objectives and to our service for our patients. So the formal management of risk is through a system of risk registers, and the risk registers are reviewed regularly and are dynamically updated. The corporate risk register, which is the highest level risk register, is reviewed at every meeting of the senior management team. In addition to this, over the past year, the board has been developing a framework of enterprise risk management. What this does is introduces an element of risk appetite as well as risk mitigation, which allows us to fully progress our vision of leading on quality research and innovation in a manner that's both safe and effective. So the board is fully committed to the work of the Scottish Patient Safety Programme. Over the past year, the 10 patient safety essentials have been fully implemented and are now sustained within the board. In addition to that, we've done substantial work on the 4 adult priorities in the main adult work streams on urinary tract infections, falls, pressure ulcers and the deteriorating patient. The work has been supported by 16 patient safety walk rounds by members of senior management over the past year.
We've continued to maintain our high levels of hand hygiene compliance with 97% over the last year. In addition, we've introduced a quality improvement facilitator post utilising money from the Scottish Government, and that again has improved the momentum in relation to infection prevention and control here at the Golden Jubilee. And we've achieved 95% of our outputs this year and have carried forward 3 as ongoing as the foundation for next year's programme. We have a robust surveillance programme here at the Golden Jubilee Foundation. Last year we had no cases of Clostridium difficile infection and very low levels of Staph aureus bacteremia. We had 2 cases of Staph aureus bacteremia and all were subject to a root cause analysis.
In the year we had a total of 51 complaints, which was 0.08% of patient activity. It is a slight increase from the previous year of 11, however the increase is in line with the increase in patient activity. When we look at the number of upheld complaints, they've actually decreased from 52% to 35%. Overall, our complaint numbers have increased, but the percentage of upheld has decreased, which is a positive sign. We are committed to improving our approach to adverse event management. In the last year, we've revised our policy to bring it into line with the National HIS framework, Learning from Adverse Events, and the focus for this year is going to be an upgrade of our incident management system, DATEX.
Over the last year, our Involving People strategy was approved by the board, and this helps us to demonstrate our commitment to equality, to diversity and also to public involvement in all the work that we do here at Golden Jubilee. We have also appointed a volunteer manager who going forward will look after the group of volunteers that we have for the organisation, and that's a service that we're growing year on year. Within the organisation we are always concerned about the patient experience and also the experience of carers and of family and also of the staff. We have various ways in which we actually gather information around patient experience, and these vary from all social media outlets that we have, from media coverage, from email, from patients just giving us positive feedback. And what we find is we collate all of that information with a communications team, and then we actually have our positive engagement score. Over the last year that score was 97.7%, which was up a wee bit from the previous year.
I've just been diagnosed with lung cancer, and I was referred to the Golden Jubilee Hospital, Clydebank, and I can say it's been nothing but great treatment from the start, right from the surgeon from day one, who explained in great detail the things they had to do from operation. Due to complications, I've had to stay a little bit longer, but it's no big deal as I have been treated with respect, dignity and kindness from nurses, staff, surgeons, doctors, physios. Every one of them is taking great care of me, and I'm so glad I was referred to the Golden Jubilee.
My first interview with my surgeon was very good in terms of, really calmed me down, and it made me feel that I was in a right place with professional people who were going to help me in my hour of need. I came out of the operation and I couldn't believe how well I felt. I've never felt ill after the operation. I felt a bit soreness naturally. If I breathe in, I feel a wee bit tightness in my back, but I've never been in heavy painkillers. That's an overstatement. I was put on them to begin with, and then asked how my pain was, and said it's just moderate. It's not severe pain at all. So I can only say that the job was expertly carried out. It's just been absolutely wonderful. The prerequisite for working in here is you need a smile. For everyone goes about with a smile.